Aloha, my name is Martha Clopin, and I created a program called Medicare Answers in Minutes. And I'm so happy today to share with you some very, very exciting news. Medicare has now developed a savings program for people who have Medicare to help lower costs of their medications. And because many people in Medicare who have that insurance, many of them, at least 90%, take medications. This can be another very valuable benefit. So we're going to start today by just taking a look at what kinds of things help you qualify for Medicare savings plans. And this is specifically related to Medicare Part D. That's the prescription drug plan under Medicare. And what some people don't know is when Medicare started way back in the 60s, 1965 it was signed into law, and 1966 it became available for the first time. There was no prescription drugs connected with Medicare. That did not happen until January 1st of 2006. And even though it was wonderful that drugs were added to the Medicare insurance program, many of the drugs that people needed to pick up were very costly, costing hundreds if not thousands of dollars to pick up medications each month. So in 2006, Congress finally heard what Medicare beneficiaries were asking for, and that was a way to save money on their prescription drugs. So what do they call the program? Well, they call the program Extra Help. That's a very interesting name because that's exactly what it does. It provides extra help for those who qualify. So many people need to know how to qualify, how to enroll, and how to continue to have Medicare savings programs, because for some people it's automatic, and other people you actually have to place an application or call the Social Security Administration. So that's what we're going to look at today. So again, what is the program under Medicare? Well, it is a prescription drug discount program, and I shouldn't say discount because it does a little bit more than that. In some cases, people can pay under $1 for their medications, and sometimes they're completely free. In addition to that, some people actually pay a cost for their Medicare prescription drugs, and when you have this extra help or Medicare savings program, that can actually be covered for you as well. So another name for extra help is called low income subsidy. Low income subsidy. But some people do not like the idea of being categorized as low income. So that's when Medicare decided to start with this new expression called extra help. However, the program is for people with limited income, so not everyone qualifies for the Medicare savings program, but about 70% of people with Medicare could benefit from learning about this program, and if they're not automatically enrolled, by finding out how to apply for it. Sometimes people have their deductibles paid with Medicare prescription drug plans. Sometimes you have to first pay a deductible between $200, $300, or even higher, over $400, just to pick up your prescription drugs. So these programs in some cases help you with that deductible. There's also folks who sometimes pay penalties because they didn't sign up for their drug plan when they were supposed to. So this plan can also help with those costs as well. So you automatically qualify for this program called Extra Help if you have Medicaid. Medicaid is different from Medicare. With Medicare, from the time you get your first job and you start paying Medicare taxes, you are qualifying to have this Medicare insurance when you meet eligibility requirements. And eligibility requirements are either due to reaching the age of 65 or if you have a disability. So once you qualify for Medicare insurance, then you also have Medicare. You can also qualify for Medicaid if you have income that's low enough. Medicaid is a program that operates as more of a safety net. Unknown to you, at some time in your life, you may have limited income. And if that is you and you qualify, you can have both Medicare and Medicaid. If you have both those programs together, your state Medicaid department will automatically enroll you in Extra Help. So people who have full benefit Medicaid with Medicare are automatically enrolled into Medicare savings programs, also known as Extra Help. Also, some people receive supplemental social income. That's in addition to your Social Security income. This is called supplemental income. And if you are enrolled in supplemental social income, you also would receive an automatic enrollment into these Medicare savings programs. Also, some people get help paying for their Part B premium. Part B is the part of Medicare that takes care of doctor visits, lab work, x-rays, things like that. And if you're getting help with your Part B premium from your state under the Medicaid program, then you also generally are auto-enrolled into the Extra Help program. For anyone who doesn't meet any of those requirements, what you can do at any time is you can contact Social Security. You can actually call them at 1-800-772-1213. I'll repeat it. That's 1-800-772-1213. And when you have the representative on the phone, you can say, I'd like to know more about Medicare savings, and I would also like to apply for Extra Help. When you make that application for Extra Help over the phone, in about 2 to 3 weeks, you should get a response from Social Security, and they'll let you know if you qualify. They'll give you a letter. They'll let you know exactly how much you'll save on deductibles, if you'll save on the premium, which is the cost of your prescription drug coverage, and also you can find out how much your prescription drug copays will be lowered. Again, some people have their costs lowered to $0.00, and that's a really good price. Most people can afford $0.00. Once again, people with Medicare and full benefit Medicaid are automatically enrolled into these programs. So if you check and you find out you have a Medicaid card, you should be getting the benefit of these lower costs, lower deductibles. So if you have both Medicare and Medicaid, and you're paying the full cost of your prescription drugs, or you're paying, quite a bit of money for them, you really should contact your insurance company, contact your Medicaid division for your state, and you should find out what's happening that you're not getting the benefit of this program called Extra Help. Also, supplemental social income. Some people, even with Social Security monthly benefits, they make below a certain amount, and they may qualify for supplemental income. So why not call and check with Social Security and see if you qualify for that? Because if you do, once again, you are automatically enrolled into the Extra Help Medicare Savings Program. Now, if you don't fall into that category and you need to apply for yourself, what's really good about applying for yourself is you learn that you can save. That's number one. And number two, it is important to understand if you are not automatically enrolled, each year you get to apply again and get a new determination as to whether you qualify. Sometimes your income may fluctuate and may be lower one year than it was in another. So you may not qualify in one year, but you may qualify the next. So very important to reach out to Social Security Administration each year. Even if you don't qualify the first year, try again and try again, because these programs change all the time. Now, if you are qualified because you are in a nursing home or skilled nursing care, still sometimes it really is important to reach out to Social Security or your caregiver to make sure the program is going to continue. And when you're in that situation, the cost of your drugs could be zero. So that's a very valuable benefit for people who are in nursing homes, because typically most of any income that you make may be going towards the cost of that nursing home. So if you can get some kind of benefit on getting those drug costs lower, that is a very valuable benefit for you or anyone that you love who may be in that situation. Also, there's other levels of help with the Medicare savings programs. Some people do not qualify to have their medications at zero, but they may qualify for their Medicare Part B premium to be paid by their state. For 2020, that Part B premium is $144.60 for most people. $144.60 every month to have Medicare Part B for most people. But if you qualify for Extra Help, Once again, you call Social Security, they may direct you to call your state Medicaid department, and that $144.60 could possibly be paid for by the state. So that gives you a little bit of extra cash each month to take care of other things that you need to take care of. So extra help is a very, very valuable benefit. Now, Medicare establishes eligibility for individuals each fall, the months September, October, and I constantly get calls from people and they tell me, Martha, I get so much mail, I'm not even opening it, I'm throwing it away. But when it comes to mail from Social Security or your Medicare insurance company, it's a good idea not to throw those letters away because they might have a very interesting program waiting for you, like extra help that can either reduce your copayments on your drugs or even eliminate your Part B premium. So make sure that if you're getting mail from Social Security and you're getting mail from the insurance company that you use for your Medicare, I would say those are pretty important letters for you to open because, again, they may be offering some kind of savings or extra help to go along with your Medicare that makes it just a little bit easier for you. Also, as I mentioned before, sometimes your status can change. Maybe you were getting income from a certain source and then you don't have that income anymore. That may also qualify you for these savings programs. So again, the main thing is remember to call Social Security at 1-800-772-1213 to learn more about extra help and the other Medicare savings programs that are available. Now, what do you do when it's time to actually choose a Medicare drug plan? Sometimes the drug plan can be part of the full Medicare Advantage plan that you might choose, but whenever you're looking at a drug plan, the first thing that you need to do is compare plans. Generally, in your zip code, there's more than one option. The option you have now, if it's working well for you, you keep it. But if you want to look each year to see what may be available, there are certain times of the year when you're able to do that. If you prepare and you find that there's a plan that might better cover your prescriptions, then you can go ahead and enroll in that plan during certain times of the year. So only certain times of the year. So sometimes, as I said, you might want to open the mail so you know what those times are. When you're looking at understanding your Medicare prescription drug plan, there's a couple things you need to do. So the first thing you should do is keep a list of your current drug prescriptions and any medications that you take. If you have to, grab the bottles and write it down, you can. Sometimes when you pick it up from the pharmacy these days, they actually give you a sort of like a label, and it will have the exact name of your prescription. It will have your dosage and your frequency. And sometimes I have people that just take a piece of paper and take that adhesive label and stick it on the piece of paper, and then they have the exact name and dosage of their prescription. Because sometimes the names are pretty long and very, very difficult to pronounce. Also, a lot of people are unaware that if you do not qualify for the extra help Medicare savings programs and you have to pay the full price as listed on your summary of benefits for your drug plan, sometimes you can save money by using what's called preferred pharmacies. So there are regular pharmacies and then there are pharmacies that are called preferred. If you can use a preferred pharmacy, you can pick up your medications at a lower cost than the standard pharmacy. That's why it's so much fun to learn about Medicare. You also should always keep your Medicare card handy, and also remember that any Medicare drug plan or Medicare Advantage plan you pick up, you will always be directed to plans based on your zip code. So if a friend of yours that lives on the West Coast tells you about a fantastic plan that they have, that plan is based on their zip code and may not be available to you. So a really great way for you to determine what plans are in your zip code, you can look up this compare plan that Medicare.gov has put out there for you. It's called the Medicare Plan Finder. And if you're not sure exactly how to use this program, you probably know someone who's good on the computer and they can help you. So what this does is it allows you to put in your zip code. It allows you to enter each medication that you take and the dosage, and it will tell you based on all the plans available in your zip code, exactly what the cost of that specific drug will be if you picked it up at a specific pharmacy. So if you learn about the preferred pharmacies, you may find out that the medications that you take would be lower under one of those other at one of those other pharmacies. So this is all good information that many people are very surprised to discover, and it could help save you money and put extra money in your pocket. There's different ways to join plans. You can actually do an online enrollment by doing it at medicare.gov. You can also go to the plans websites. Many of the plans have websites. You just want to make sure you have the legitimate sites, because there's a lot of scam sites out there as well. So if you find the website for the plan, they offer a way for you to do an online enrollment. You can also enroll by phone, and you can start that process by calling the plan, or you can call 1-800-MEDICARE. Now, Medicare has their line available 24 hours, 7 days a week. So if you want to enroll in a plan at 2 o'clock in the morning, you absolutely are welcome to do so. So Medicare is available to you at 1-800-MEDICARE, MEDICARE. It's available to you 24 hours, 7 days a week. They can answer questions for you and also can take care of enrollment. But remember, not everybody can enroll at the same time. So there are specific enrollment periods. You also can enroll into a Medicare drug plan or Advantage plan using a paper application. And again, with a call to the plan that you're interested in, they can help you with that. Now, what can new members to Medicare Part D drug plans expect? Well, the plan will send you a welcome letter, also known as an enrollment letter, and that will describe all the features of your Medicare drug plan. A gentleman called me earlier and he said, Martha, I would like to get my medications through the mail. So how will I do, medications by mail? And I said, when you get your welcome letter, the plan will explain to you exactly what information you need to provide to your doctor, so your doctor can actually get in touch with that mail order pharmacy. There's mail order pharmacies out there, and then the medications will be mailed to you, typically on a 3-month schedule. And once your doctor and that mail order pharmacy are in touch, it will be exactly the way you get a prescription called in for your local pharmacy that you pick up yourself. So mail order is a great way to lower costs. Sometimes mail order, not all the time, but many times mail order medications are very inexpensive, sometimes zero, even if you do not have that extra help or Medicare savings program. So it's good to understand you will get a welcome letter or enrollment letter from the plan. It will have a card, your member identification card, that you'll use when you go to the pharmacy. So a lot of people, when they get Medicare and they get their Medicare red, white, and blue A card, B card, they do not realize that for the prescription drugs, you'll need a separate card or you'll need to have that in whatever Medicare plan of your choice. And that is the card you'll use to pick up your medications from the pharmacy. Again, if you decide to go with a mail order pharmacy, your plan will take care of setting that up for you, and your doctor will contact the mail order pharmacy to give them details of your medications and prescriptions. Important to understand, sometimes people pick up a plan and they have this plan for a while, and when they selected the plan, all of the medications that they take were covered by the plan. But what happens if the doctor prescribes something that is not on your plan? Well, Medicare prepared for that. And your doctor or yourself, you can actually contact Medicare or the Part D insurance company that you have, and you can ask for an exception. If the exception is granted, even though that medication is not covered by your existing drug plan, you still will be able to pick that medication up and get some coverage from your current Part D prescription drug plan. So there's a lot of different rules surrounding Medicare that allow you to actually get help to make sure that you're not left without any coverage at all when you're on a Medicare drug plan. Now, another very important document that people typically receive the end of September of each year is called Annual Notice of Changes. those of us in the industry, we call it ANOC, but it's actually Annual Notice of Changes. And that's a very, very important document because that document will let you know if there have been changes to your Medicare prescription drug plan, or if it was a Medicare Advantage plan, changes to that as well, because that's really the only way you can determine if you need to make a change. So if you find out that a medication that was covered and maybe your out of pocket was $3 or $5 or $10, what if you learn that that medication will no longer be covered and you would have the full cost of that medication, maybe $50, $100, or even $1,000? I do know people who have very expensive medications. So what you get to do with that annual notice of change is you use that to determine if you might need to look at other prescription drug plans during the annual enrollment period. So annual enrollment period starts October 15th each year and it ends December 7th, but the annual notice of change is the document that explains to you how your plan will work for the new year, and if you need to pick up something else, then that's the information. All of it is contained in the document that gives you an idea of what you need to change to. So that document will include what's called a summary of benefits that tells you exactly how your drug is covered in the plan. Drugs that are called generic drugs or tier 1 are covered at the least cost. Drugs that are considered brand drugs typically are much higher, and your injectable drugs can be very, very expensive, even into the thousands. So very important to read that annual notice of change, or an ANOC, and make sure that you understand how your plan will work, and make sure if you need to pick up a new plan, again, you pick it up during the correct enrollment period, which is generally that annual enrollment period from October 15th to December 7th. Now, just a couple key points to remember. Medicare D is the part of Medicare that provides your Medicare prescription drug coverage. Now, some people get a little confused because Medicare Part B also can cover drugs, but not the ones you pick up from the pharmacy. Medicare Part B covers drugs that are administered in a hospital setting, a doctor's office, that are injectables. Sometimes people are taking injectable medications for very, very serious illnesses, and those particular drugs are administered under your Medicare Part B. When it comes to drugs that you'll pick up from the pharmacy, that is your Medicare Part D, and that will cover your prescription drugs, the Medicare Part D. Now, you must take action to join a plan. Some people, when they qualify for Medicare, they get their Medicare Part A and B card, that red, white, and blue card, but the drug plan is not included. So you actually have to follow up to find out if you will need a drug plan and whether you'll get that from an all-inclusive Part C plan, or you're just going to pick up a separate Part D to go along with your A and B. But if you want to have coverage for drugs you pick up from the pharmacy, you must join a plan that has Medicare D. Also, you have many choices on how to get that coverage. You can contact Medicare, you can contact the plan, and extra help is available to people with low income or limited resources. Always makes sense to apply and see if you might qualify, because it is very important to see if you can qualify for any extra help when you have Medicare. Because many times people who qualify for Medicare insurance, they are on limited incomes, so every little bit can help you meet other needs that you have. And the other thing I like to share with people is Medicare is a type of insurance that you may have for 10 years, 20 years, 30 years, or longer. So very important, if you can start to lower those costs when you first go on to Medicare or any time in between, it's going to help you maybe juggle some of those other household expenses a little bit better. And maybe even during the retirement years, the Medicare years, you'll have a little extra money that you can save. Many people that I talk to are in their 80s and 90s, and they seem like they're going to be going for quite a long time. So they don't want to run out of money. So Even when you're in your Medicare years, you can save a little money if you follow up and find out about Medicare savings programs and extra help. I want to thank you so much for your time today, and I look forward to you looking at some of the other videos that cover Medicare. Aloha.